Welcome to My channel. Saudi Physiotherapy License Exam Most Important Questions and Answers. Palpation for piriforms. A. From SIS to greater trochanter. B. From PSIS to greater trochanter. C. From coccyx and iliac crest. D. From sacrum to greater trochanter. Fracture dislocation to L4.L5 will result A. Flaccid paraplegia, B. Quada equina. To transfer a complete T4 paraplegic patient from wheelchair to Menpai, A. Squat pivot technique, B. Stand pivot technique, C. Back out technique, D. Sliding board. Burst fracture, which area that affected? A. Spine, B. Talus, C. Scaphoid. Which is irreversible in coronary heart disease? A. Past history of peripheral vascular disease, B. Smoking, C. Hypertension, D. Hyperlipidemia. The cause of cardiac arrest after electrical shock? A. Fright, B. Low heart rate, C. Ventricular fibrillation. Tool provide physiotherapists with visual and auditory signals to monitor muscle recovery. A. Biofeedback, B. EMG. Finger examination, rectus abdominal separation in pregnant women when to consider it significant. A. 1 centimeter, B. 2 centimeters, C. 3 centimeters, D. 4 centimeters.
Which movement not accompany with hyperextension of cervical spine? A. Poking chin. B. Decreased flexion of lower cervical spine. C. Increased activity of SCM and levator scapulae.
Initiate muscle contraction, alpha fibers, B. Gamma fibers. Contraction in which no doubt change in muscle length, isometric. Where the Broca's area for speech in dominant hemisphere, A. Superior temporal lobe, B. Inferior temporal lobe, C. Subfrontal lobe, D. Inferior frontal lobe. Muscle force. It is the force exerted by muscle to overcome resistance under specific set of circumstances. Gland responsible for growth. Hormone. A. Thyroid. B. Pituitary. Regarding closed chain exercise, what of the following? A. No resistance to distal part. B. Avoid strengthening 90-120 flexion. C. Knees doesn't go posterior to toes. Contraindication to exercise. In pregnancy. A. Diabetes in pregnancy. B. Pain. C. Musculoskeletal discomfort. SWD has two ways of application. Contraplanar as in knee, the electrodes against each other. Coplanar as in treating back, the electrodes in the same plane. As a result of diminished movement associated with Parkinson's disease, a physical therapist might use cueing strategy primarily to help improve A. Trunk stability and proximal tone, B. Trunk rotation, C. Upper extremity function, D. Guide. Performance. It is the capacity of muscle to contract to generate force, to produce, maintain, sustain, and modify posture. For strengthening muscle, we do electrical stimulation for a 0 pulse, B5 pulse, C16 pulse, D20 pulse. Contraindication in tense stimulation, heart pacemaker. Optimal way to measure muscle exercise capacity, A. Volumax, B. Handheld device. Flexibility, it is ROM of given joint that is affected by muscle contraction and ligament stretch, is exercised to increase flexibility. Physical therapists working with a patient to improve the difficulty to reaching overhead and brushing hair. What is that according to ICF? A. Participation restriction. B. Activity limitation. Extensibility. It is the ability of muscle to be stretched. Elasticity. It is the ability of muscle to recoil or bounce back to its original length. Patient have problems in ROM and muscle weakness is classified as A. Participation limitation, B. Functional impairment, C. Personal factors, D. Activity limitation. Housemaid's knee, inflammation of the fluid filled cavity covering the kneecap, often due to excessive kneeling. Which part of ultrasound that produce that ultrasonic waves? A. Head of ultrasound. B. Transducer. What is the function of Ruffini dot end organ? One of the encapsulated sensory nerve dot endings found in the dermis and in subcutaneous tissue, once thought to mediate the sense of warmth, now that believed to be a pressure receptor. What is the main cause of breathing? Ineffective in upper thoracic and cervical SII? A. Recurrent pneumonia. B. Paralysis of abdominals. C. Paralysis of intercostals. Patient make exercise feel pain in leg and thighs after 48 hours of exercise. Delayed onset muscle soreness. Patient 12 years with right facial palsy can't look to the right side. Which muscle? A. Lateral recti, B. Medial recti, C. Superior oblique, D. Inferior oblique. Abductor pollicis brevis paralysis. Dot which nerve affected? Median nerve. Transfer chemical stimulation to mechanical. A. Small intestine, B. Stomach, C. Skeletal muscle. Long thoracic nerve supplied up which muscle? Serratus anterior muscle. 30 years old man, shoulder pain near deltoid insertion up the shoulder cap. Dot refers down lat arm to elbow. Which is the reason for the pain? A. Teres minor, B. Levator scapula, C. Deltoid. Wernicke's area in which gyrus dot of the brain, superior part of temporal lobe. A patient with a recent history of rib fractures suddenly becomes short of breath during secretion removal techniques. The patient looks panicked and complains of sharp pain in the left chest. A quick screen shows a deviated trachea to the right, among other signs and symptoms. The most likely explanation for the above is A. Angina, B. Pneumothorax, C. Pulmonary emboli. Patient with stroke, the neurologist dot refer him to patient first for assessment. Physiotherapist find A. Chorea, B. Nystagmus, C. Aphasia. A patient has a complete spinal cord lesion at the C5 level. It is important for this patient to generate a functional cough in order to avoid potential respiratory problems. In this case, effective coughing A. Should be facilitated by use of phrenic nerve stimulator. B. Should be facilitated by use of dot glossopharyngeal breathing. C. Can be elicited with manual dot abdominal pressure provided with the assistance of a caregiver. Hysterectomy makes hot flushes dot and redness is managed by hormonal replacement therapy. Acute respiratory distress most dot important I pain dot B decrease accumulation of dot fluid. Define spondylolisthesis. Vertebra above vertebra, move forward. Best exercise for COPD: A. Walking, B. Cycling, C. Swimming, D. Running. Which type of exercise involves dot muscle contraction without joint movement? A. Isometric, B. Isotonic, C. Isokinetic, D. Plyometric. A stroke patient shows flaccidity initially, then spasticity. This is due to A. LMN lesion, B. UMN lesion, C. Muscle disease, D. Peripheral nerve injury. Exercise professional autonomy, hard work, B. Patient safety, C. Critical thinking, D. All of the above. TENS is primarily used for A. Muscle strengthening, B. Pain relief, C. Increasing ROM, D. Reducing inflammation. A patient has pain during shoulder abduction between 60 to 120 degrees. This is called painful arc syndrome, B. frozen shoulder, C. bicipital tendinitis, D. shoulder instability. Most common cause of falls in elderly: A. visual impairment, B. balance disorders, C. muscle weakness, D. all of the above. Thanks for watching.